Hello and welcome to the Fit to Transform podcast, where you learn how to train and diet effectively and, most importantly, how to maintain those results for life, once and for all. I'm Nikias Tomasiello, a transgender training and nutrition coach working online with anyone who's ready for a true lifestyle transformation, anywhere they may be in the world. As a friendly reminder, any and all information provided is for educational purposes only. You should consult with your doctor before implementing any changes to your diet and exercise program. With that disclaimer out of the way, thank you for being here. Now grab yourself a cup of tea or pre-workouts and enjoy. Yo, dear listeners, hello and welcome back to the podcast. Today, I have a guest whom I first interviewed back in 2023, Dr. Gabrielle Fundaro. Gabrielle, welcome back to the show.
Thank you for having me back.
At the time when we first spoke, we discussed the truth about gut health. That was the title of the episode, which is episode 29 for anybody who wants to listen to it. Since then, your passions and interests have taken your career in quite a different direction. So the first question I usually ask to break the ice, it gives the opportunity to the guests to introduce themselves. I think with you, it would be great to have a reintroduction and to hear where you're at right now.
Oh, thank you. I kind of retired from gut health science communication last year after speaking about it for several years. That was the main area of study of my doctorate. But my background is in exercise science and health education. And I had a few years of overlap of speaking about gut health science and also speaking about the realities and the science of intuitive eating and of weight neutral approaches to health and wellness. And really at the core of it, it's that I want people to be able to make informed decisions. And I want to know everything about whatever topic I'm interested in at the time. And also, I wanted to make sure that I was coaching effectively and safely, and that I was actually helping the clients that I was working with. And so, even though gut health was my initial platform, I pursued more education and training in coaching and in weight neutral approaches. And I decided to take the full leap to dedicating myself to what I was really, really passionate about, and just leaving my gut health stuff out there for free. And so there's an archive of gut health science stuff still.
That's so interesting. And then, Gabrielle, you gave this incredible presentation at the Australian Sports Nutrition Conference this year, which was actually in America. I couldn't attend, but I purchased the online tickets, so I was able to access your presentation that way. And it was on the topic of intentional weight loss and its potential risks as well as benefits. And I thought it was so well rounded because there are many aspects of this topic that I don't think are discussed enough. And so I thought I definitely want to have you back on the podcast to talk about this specifically. So to start with, I would like you to explain to the listeners why this conversation about weight loss matters. Why should we even talk about pros and cons? Why can't we just say, like most people say, you want to lose weight, get into a calorie deficit, and off you go?
Yeah, yeah. What's so interesting is that when a person signs up for a gym or they start working with a personal trainer or they sign up for like a weightlifting competition, or they want to engage in a club sport, all of these come with the requirement of signing a waiver. You have to sign an informed consent waiver to say, I'm aware of the risks of engaging in this activity and I'm willing to take those risks on. And it's protective for both parties. But we don't do that with intentional weight loss because it has become so normalized. It has become the default and really has become kind of like the right thing to do, to the point that if you suggest not pursuing intentional weight loss, especially if we're talking about intentional weight loss for people in larger bodies, it's automatically assumed as uninformed and wrong and many other negative things. And so, what I want to do is bring more attention to the fact that we need to empower our clients. We need to empower individuals with the ability to provide informed consent in the same way that they do with other high risk endeavors. We need to acknowledge that intentional weight loss is a high risk endeavor. And even though we might not see the obvious physical risks like we would see in a contact sport, that doesn't make them any less important. And in the same way that we wouldn't ignore a client's pre existing physical injury, we can't ignore the client's pre existing history and the context in which they have lived in their body and in which they want to potentially change their body.
Yeah, that makes perfect sense. And I love the comparison with activities like signing up for a gym and having to sign a waiver. My understanding is that what you're saying is we need to give clients the ability, or people in general, the ability to provide this informed consent by letting them know about both the benefits and the risks of intentional weight
Mm-hmm.
loss.
Exactly.
I think as we move into this conversation, it would be helpful to um, discuss some definitions. So when it comes to the term intentional weight loss, my understanding is that you're differentiating between losing weight on purpose, what most people would call going on a diet, as opposed
Mhm.
to losing weight by accident, for example, as a result of emotional distress. Is that correct?
Yes, exactly. Because it's really not about the weight loss itself. It's about the how and the why that we're pursuing the weight loss. So a person might be engaging in a lifestyle change that increases their physical activity level and reduces their food intake without a specific weight goal, and they may lose weight. The difference there is that we're not counting the amount of weight loss. We're not tracking that. It just happens to be a side effect of the behaviors that they're engaging in. Whereas when we're talking about intentional weight loss, there are generally two subcategories that I use. We have intentional cosmetic weight loss, and that's weight loss that is just intended to change our external appearance. And then there's more of a health focused weight loss. Of course, there's going to be overlap there, but there are individuals that want to pursue weight loss just in order to improve their physical health markers, improve potentially joint pain, and there's not anything aesthetic about it. They don't have a concern about their appearance. They just want to, either improve their exercise or sport performance, or they are just following recommendations maybe by their doctor. And those two categories of intentional weight loss carry different risks, a different level of risk, and a different level of potential risk to benefit ratio. And when we look at unintentional weight loss that occurs as the result of, just a weight neutral approach behavior changes, that weight loss in and of itself doesn't necessarily come with psychological risks.
I really like how precise you are in differentiating the intention because it really drives home the point that intentional weight loss is an intervention similar to starting a new medication or starting an exercise program.
Mhm.
And that's why it's important to appreciate its risks. Something else that you also tend to discuss, I've noticed, is the concept of healthism. And so I would like you to talk a little bit about that to make the audience aware of what it means and how we can utilize it or hear about it in the context of intentional weight loss.
Yeah. Healthism is a concept that was characterized in the 1970s, and it describes the attachment of morality to one's physical health status, one's civic duty. Back then, there were a lot of messages going around about food conservation related to the First World War. And the assumption was that if you were conserving food, you should be in a small body because society had just learned about the relationship between food intake and body weight and energy balance. So there was also an attachment of morality and the one's fulfillment of civic duty to body size, because if you were in a large body, it was assumed that you were hoarding food, you were eating more than your fair share, because it was being stored in the form of body fat. So when we look at the way that people think about individuals in large bodies, and we look at the assumptions that they make about what those people are like and what they're supposed to be doing and what we think is the right and moral thing to do. Healthism and weightism explain why we assume that weight loss is a good idea and that it's something that someone's supposed to be doing, and that if someone's in a large body that they really have the obligation to try to be in a smaller body, because we are assuming that someone in a larger body also has a poor health status. And it's part of everyone's civic duty to maintain their health status, to maintain a specific acceptable appearance in order to provide to society, engage in their civic duty, and really also contribute to capitalism. Because when they say we want to make America healthy again, they don't mean they want everyone to be really flourishing and thriving in a sense of thorough well-being, but rather that they want them to just be physically able to uh, enter the workforce.
That makes perfect sense, and I find it so fascinating that there are so many cultural, historical, socioeconomical ramifications within the concept of weight loss that further muddy the waters when it comes to our ability to understand that it is a medical intervention.
Mhm.
Because there are all these reasons why we are told that to assume that it is the right thing to do under all circumstances. Now, for the final definition, I wanted to explore the concept of weight stigma with you. So, what it is and how it affects people and their interfacing, their decision to interface with intentional weight loss.
Yes. Weight stigma is the set of negative beliefs about one's body size. Now, weight stigma exists within society. People have negative beliefs about people in large bodies. Weight stigma is harmful to anyone who has a body, but it is especially harmful for people who live in larger bodies. And it is doubly harmful when an individual internalizes those beliefs and then believes those negative things about themselves and about others as well. So the level of internalization of weight stigma is an independent risk factor in and of itself, in addition to having lived in a society that has these stigmatizing beliefs, and then that people engage in weight bias. And so that's the differential and negative treatment toward people who exist in large bodies. So it's possible that a person has existed in a large body and hasn't experienced weight bias behaviors, and that they haven't internalized weight stigma. Now, they'll be at a lower risk level than someone who has experienced weight bias and who has internalized weight stigma, but that doesn't mean that they are completely free of risk. And likewise, a person can be in a smaller body and have internalized those weight stigma ideas, and that is going to put them at higher risk than a person who lives in a smaller body who has not internalized those weight stigma ideas.
Again, it's so important here to bring up and highlight the fact that the ideas that we are discussing have nothing to do with the person's actual shape and size, but more so with their cultural conditioning.
Mhm. Exactly. Yes. It's about how others perceive them and how others have treated them. That is going to play a really important role in not only their motivations for intentional weight loss, but also the potential harms of pursuing intentional weight loss.
Speaking of harms, let's talk about the benefits and the potential downsides of intentional weight loss. Let's give the audience a really well-rounded understanding of this that I think is missing from a lot of conversations for the reasons that we've discussed so far.
Absolutely. It is hard to find messaging that includes both the benefits and the risks. And I've always done my best to try and include both of those and speak to the middle. Because research shows, a large body of research shows, that in individuals who are living with overweight or obesity, even a small portion of weight loss, even about 5% of body weight, is associated with improvements in cardiometabolic health markers and outcomes, in liver health, in glycemic control, and even in reproductive function. So, when we think about it think about that in isolation, we can say that there are some benefits, especially when we're looking at interventions that are behavioral focused weight loss interventions. There are even there's even evidence that these intentional weight loss programs are associated with improved quality of life, lower depression scores, improvements in body image, and improvements in disordered eating scores in individuals who were had a high score of disordered eating at baseline. That's in individuals who are living with overweight or obesity. I'm going to talk about the caveats there too, but that's at face value. That's what we see in the literature on intentional weight loss. And then there are also other factors, like there are reports of reduced joint pain. And so, when we're looking at quality of life, we're not thinking just about health markers in a blood panel, but also a person's ability to move comfortably and navigate our environment. In individuals without overweight or obesity, usually we're looking at athletic populations. We don't really see a lot of weight loss interventions for people who are of quote unquote normal body weight. In athletic populations, a small amount of intentional weight loss doesn't appear to have any negative effects on exercise performance. So we're talking about, like, again, less than 5% of body weight at baseline. Even if that's done kind of short term with like safe, relatively safe weight cutting practices, to make weight for a sport, that doesn't appear to have a deleterious effect in isolation. And likewise, if an athlete is losing a moderate amount of weight, using safe practices in a way that is aligned with improving their sport performance, then those things seem relatively benign. But like I said, I want to touch on the caveats here. So going back to the behavioral focused weight loss interventions, the thing that's unclear here, which I will clarify, is whether that those benefits are due solely to the weight loss in isolation or due to the behavior modifications and the improved social support and the improved emotional regulation skills that people can build, because a lot of these programs include working with a health professional, things like cognitive behavioral therapy, group support, and all of those things independently can improve things like depression scores and quality of life. So when we separate the weight loss and we look at the correlation between just those behaviors and positive outcomes, we see that there are two important findings. One, in these behavioral weight loss interventions, when people lose little to no weight, they still experience these mental and physical benefits. And we also see these mental and physical benefits in weight neutral approaches, where weight is not one of the outcomes that's tracked. So that right there tells us that those outcomes are actually not highly correlated with the weight loss itself. What is tightly correlated with the magnitude of weight loss is the improvement in body image. But it's not overall body image. It's just body satisfaction or dissatisfaction. So what could be happening there is that people in large bodies that have shrunken their bodies and moved closer to the societal ideal may now be experiencing less weight stigma, both externally and internally, because now they're closer to society's ideal. So they're less satisfied with they're less dissatisfied with their appearance. That is not synonymous with a more positive body image, because positive body image encompasses body acceptance, body flexibility, and body appreciation and body functionality appreciation. And without targeted interventions, those don't improve just because someone likes the way that their body looks. And then, in fact, that can actually increase their appearance preoccupation and make them more concerned about maintaining that weight loss. So that's what I want to stress here, is that we can't take those findings just at face value. We have to look at the context. And that allows us to see if we can get all of the same benefits without intentional weight loss, without that focus, and we don't have the same risk factors, that is probably going to be a more effective route to take. And equally with people engaging in athletics, yes, a 1 or 2 time weight cut the small amount done safely in isolation, we don't see that there are harms or risks associated with that. But over time, cycles of repeated weight gain and weight loss, weight cycling does have negative effects both psychologically and physically, not just in terms of health, but also in terms of performance. So again, we have to look at the context. And when we see that athletes are trying to suppress their weight long term, they're trying to stay in a lower weight class that's much lower than what would be achievable without a lot of cognitive restraint and restriction, that puts them at risk of developing disordered eating and also of the effects of low energy availability and relative energy deficiency syndrome. So again, it's about looking at the effects in the context and then weighing out the risk to benefit ratio. So we can say, yes, there are benefits, but those benefits come with a price tag, with a side effect that could, in some cases, outweigh the magnitude of those benefits.
I have some questions that I took notes about as you were talking. The first one is,
Mhm,
you were careful to clarify that these evidence emerges from behavioral interventions. So for the listeners,
mhm.
what's the difference between behavioral interventions as opposed to what is it that you're comparing them to?
Hmm. So, behavioral weight loss interventions are interventions that include not just a specific diet, but also things like I mentioned, like working with a health professional. So there's a level, an added level of professional support, and they focus on not just the diet, not just like, oh, you're going to go on a 16-week low fat diet, but also on the mental health aspects. So helping people understand their cognitions better, speaking with others, connecting with others that are also engaging in the weight loss intervention. So there is a focus on behavior change beyond just changing the diet. They also will generally include an exercise aspect as well. So they're going to be engaging in regular physical activity. Whereas if we have an intervention that doesn't include behavior change, which is a lot of fitness interventions, a lot of times it's just a meal plan, it's a nutrition focus, it's just we might have a training plan, but the thing is training plan and nutrition, then it doesn't have those added aspects of the psychological and emotional support. And in that case, that individual is only focusing on, eating a certain number of macros, following a specific diet, and following a structured exercise plan. And in those interventions, especially when we pair them with self monitoring like calorie tracking and weight tracking, those actually do increase the risk of disordered eating. And in part because there is a greater preoccupation, a greater focus on body size. And in a person who has internalized weight stigma, when you combine those factors together, that really does set them up for a higher risk of not only worse body image over time, but worsening disordered eating.
Thank you for the clarification. And then at first, you were saying that research has shown that even a relatively small amount of intentional body weight loss in the realm of 5% can lead to improvements in health markers in people with
Mhm,
obesity or that are overweight. Then you
mhm,
also mentioned that in these behavioral interventions, these mental and physical health benefits are still present. So I just wanted to ask for clarification. Are you saying that even without weight loss, we are still seeing an improvement specifically in the health markers such as blood pressure, lipids, and the other aspects that relate specifically to physical health?
Yes, that's correct. And it's likely because exercise is a more effective intervention than weight loss itself. Now, what we find in the follow up after these behavioral weight loss interventions is that, yes, with regain, a lot of the physical health markers are kind of returned to baseline. So, if a person loses, say, 10% of their body weight, which is generally recognized to be that's what we say, successful weight loss. Lose 10% of your body weight and maintain it for at least a year. That's considered to be successful weight loss and weight loss maintenance. That was generally considered to be the cutoff to be able to see clinically relevant improvements in physical health markers. But when we follow people long term, it's very rare that they will maintain a weight loss of 10% body weight. So even if they regain some weight and they maintain a net loss of, say, 5%, they will still maintain a large majority of the physical health benefits, even if they get down to maybe 3% net weight loss. Below 3%, then they're probably not going to keep seeing those same those same health markers. What's important to think about though here is that with these behavioral weight loss interventions, the improvements are only maintained for as long as the behaviors are maintained. So if this person engaged in the intervention for 6 months, we usually see these results peak at about 6 months, and then by 12 months, a lot of them are close to baseline or lower than they were. So after 12 months, if the person has completely stopped all of the behaviors that they were engaging in before, it's really no surprise that then we would see a reduction in those health markers. But it's not necessarily because they have regained weight. Rather, it's more likely that it's because they're not exercising anymore. They're not eating a nutritious or nutrient dense diet in the way that they were before. They don't have the social support that they had before. And so when we look at weight neutral approaches and see that you don't necessarily have to lose a large amount of weight, you don't necessarily have to lose any weight at all to see these benefits. Those things together tell us it really is about the behaviors. It's about especially the physical activity that is leading to the improvements in physical health markers in the vast majority of cases. And of course, there are exceptions to that. In the case of a high level of excess body fat, then having a reduction in body fat levels would have a synergistic effect with exercise performance, with physical activity levels. But when we look at comparisons between people who have overweight or obesity, who have a really high level of fitness, whether it's muscular fitness or cardiovascular fitness, their health risk, their disease risk, is just as low as individuals with a normal body weight and a high level of fitness. So again, there is so much evidence that shows us that it really is about the behaviors. It's about engaging in physical activity. That's what's providing the vast majority of the benefits. And weight loss is just a side effect.
How interesting. So, just to clarify, can you also cover your thoughts and your understanding of the evidence when it comes to the risks of excess body fat levels from a physiological, psychological, from all perspectives that you can think of that might be relevant?
Absolutely, yeah. So a high level of body weight, if we want to say, someone has overweight or obesity according to BMI. Not so much with overweight. There's a lot of gray area because BMI obviously only captures weight. It doesn't capture body composition. But if we take weight and body composition into consideration and we look at individuals who have a high BMI or a high level of body fat, that can put them at risk for developing cardiovascular disease, type 2 diabetes, and the comorbidities that would go with those conditions. And it also is linked with osteoarthritic pain. And then in terms of psychological distress, because individuals in large bodies are going to experience more weight stigma, and because they are navigating an environment that is not built for them, that they are going to experience they're more likely to experience anxiety, depression, loneliness, low self-esteem, and body image disturbance. And they're likely to internalize that weight stigma. What I want to really make clear, though, is that it is not the weight that is causing the psychological harm. It is the environment in which that they're living. It is society that is causing that psychological harm. Because I want to make it clear that that's not, it's not the weight that's doing that. Weight can't cause those symptoms. So those are what we see in terms of the risks associated with a high level of body weight. And it can also make it more difficult for folks to engage in health promoting behaviors because they will feel sometimes like they're not welcome. There's a lot like that stigma can be directed at them when they try to go exercise. There's really negative portrayal in the media. It's hard to find exercise clothing that fits appropriately. It's hard to find exercise machines that fit appropriately. So there are obstacles, there are additional obstacles that make it more challenging for them to engage in the health promoting behaviors that could reduce the risks associated with the body weight, because it's not really necessarily just the body weight. Again, it is the sedentary behavior that is contributing a lot to those health risks.
Yeah, I'm really glad I brought you on because I find it hard to find somebody who's going to have such a nuanced view about this, where we're not saying that weight loss is always harmful and never necessary. We're also not saying that having excess levels of body fat is absolutely fine. Whereas I find that depending on the camp that you speak to in the health and fitness community, you're going to find these very polarizing views. Whereas here we're having a really detailed conversation about, yes, there are risks to having excess levels of body fat. There are also risks to having to pursuing intentional weight loss. And I think where these risks and benefits intersect is context. And that's something that you talk about a lot. So when you as an individual, the listener, for example, is deciding, should I pursue intentional weight loss? How can they take into account their context to make that decision?
I love that question. And I do want to make one more point that I wanted to touch on earlier and I forgot, which is also relevant. I think part of the reason that people have a hard time with the body positivity movements and the idea of body acceptance is that deciding to remain in a state that is associated with health risk seems offensive to some people because they think that you are supposed to be doing your part to maintain your health. Because if not, if you require more health resources, then you are, then other people kind of have to subsidize your health. Now, interestingly, that is really specifically applied to people in large bodies. Like we don't see the same stigma attached to people who are smoking or drinking, or engaging in fad diets, like all of these other behaviors that are deleterious to health. So the other thing that I want to make clear is that even though there are health risks associated with excess body weight, and even though there are health risks associated with intentional weight loss, I personally don't care what other people want to do. I mean, if a person knows that there are risks associated with being in a large body, if they are experiencing something related to being in a large body, it is not my place to try and shame them or convince them. Those are not effective behavior modification modalities anyway. But the reason that I want to talk about the health risks of either side is just so that people are informed. And there's nothing wrong with having a health condition. And there's nothing wrong with how you decide to interact with that health condition. Like I have ADHD and I take medication for it, and the medication is life changing to me. It helps me function in this society. If a person chooses not to take medication, that is completely their right. And I think that's where we end up getting into arguments rather than having the productive conversations, because there's so much blame and shame going from one side to the other. And really, I just want to say, hey, this is just information, and you have complete bodily autonomy, and you are an adult. You can make decisions about the way that you want to interact with your body. And to say that it's a problem for certain people to want to use to require more healthcare resources, that's just an assumption that you're making based on the person's body size. You really don't know their health status. And B, that is a problem created at an institutional level that convinces us to blame those around us for the resources that they need, rather than looking at the institution itself and saying, why aren't these resources being made available to us? Why do we feel like we have to compete for these resources? That's the real problem. And I think that conversation is changing recently because people are understanding this is not a left right problem, this is an up down problem. So that's encouraging to see. But that is something that I want to highlight that I think is not um, covered as much as it should be, to say, even if we're saying that there are health risks associated, that doesn't mean that you are bad or wrong for living in a large body or for pursuing intentional weight loss.
My understanding is that it comes back to the concept of healthism, where
Yes.
because there's a health risk, now it's a moral obligation to take care of that health risk, when at the end of the
Yes.
day, it's your choice and it has nothing to do
Mm-hmm.
with your worth as a person or your morality or your standing in society.
Exactly. Exactly. Yes. Snap, snap, snap. Absolutely. Um, so, and so to your question about, if a person does want to pursue intentional weight loss, Um, I have never been completely weight neutral, even though that's what I center in my practice, because the type of clients that I work with, like they a weight focused approach would just be worsening the sort of pre-existing injury, that they have. If a person wants to pursue intentional weight loss in the safest way possible, first would be examining the real motives behind that decision. Is it coming from a place of shame, of anxiety, of fear? Is it something that you think is going to make your life better overall, because you think that it's going to make you feel more accepted and safer, and maybe you even like the way that you look more when you're in a smaller body? Those are signs that you have internalized weight stigma and you believe these negative things about yourself. And even though you might like the way that you look in a smaller body, you're not actually developing the psychological flexibility and resilience and positive body image that will help you feel good about yourself in a way that's not contingent on your appearance, which is what you really want. You want to feel good about yourself. And the thing is, when that's contingent on the way that you look, it's not coming from a place that can really be stable and permanent and resilient. And it's more based on how other people are interacting with you or how you want other people to interact with you, rather than about how you are interacting with yourself. So in that case, pursuing intentional weight loss might give you some temporary relief from the negative body image thoughts and the anxiety and the fear, but is not going to be a long-term satisfying solution, because that's going to come from actual targeted body image interventions and support for your mental and emotional health. Now, if on the other hand, you are aware that there are health risks associated with a high level of body fat, you have concerns, you have actual evidence that maybe your health is being affected, and you don't have a history of trouble with your body image or with your relationship with food, and you want to find new physical activities and new ways of eating that can be supportive of your health and then potentially also lead to intentional weight loss, that's a much lower risk endeavor. There are still risks to consider. You could, over time, develop a greater preoccupation on your appearance. You could develop some neuroses around your food intake. So that's something to keep in mind. And in either case, again, it is about determining where that motivation is coming from. If it really is like, hey, I want to run a marathon, and I think that if I were, a little bit lighter, then that would help me. Like, and I'm referring this is a family member, so I know this family member doesn't have any sort of history of weight stigma, weight bias, They don't have any body image concerns. They're really just like, hi, I really love my wife's cooking, and we eat a lot, and yeah, I just want to be able to make some different choices, and I know that that's going to lead to weight loss. But weight loss isn't the main focus. We're not tracking weight every day or even most days of the week. We're not relying on macros. Then that's an approach that would be much less risky. And that's an approach that would be coming from a different set of motivations. So there's really this spectrum of the context in which intentional weight loss is pursued. And I would just encourage folks to really examine the reasons behind the weight loss and what they think it's going to provide to them. Because weight loss will provide you with one thing: a lower number on the scale. It is not going to provide you with a more positive body image or better self-assurance or respect and being valued by your peers. Those are all things that come from the way in which you interact with yourself and interact with those around you.
And the behaviors that you engage in as you pursue intentional
Yes,
weight loss.
exactly.
So let's say, Gabrielle, that I've made the decision to pursue intentional weight loss. Um, in pursuing this endeavor, I'm going to use the same word twice, whatever.
Mhm.
What kind of behaviors or ways to look at behaviors that will cause weight loss would have a lower risk profile?
Absolutely. So first would be that we want to build in psychological protections from the beginning. So we want to be practicing self-compassion. We want to be practicing body appreciation and body acceptance. And we want to be addressing the negative body image thoughts that come up. Um, we are not expecting that you're never going to have a negative body image thought or that you're going to be satisfied and love every part of your appearance. That actually could be maladaptive. But we want to ensure that there's a level of flexibility there so that you're not highly attached to your appearance. That's going to set a strong foundation because positive body image protects against the influences of things like social media and body dissatisfaction. So we're less likely to react to those things by like, oh, I need to restrict more. The second thing is that as much as possible, we still want to rely on internal signals. Now, I do want to make clear that in some cases, internal signals are difficult for people to interact with. Either they're neurodivergent, or there's maybe a trauma history, or they're on a medication. And so it's not as simple as saying, oh, just listen to your body, eat when you're hungry, and stop when you're full. But we want to, as much as possible, tune in to signals that we can sense. Maybe hunger doesn't show up like emptiness in my stomach. For me, it usually doesn't because, again, I'm on medication. Hunger for me shows up as I can't focus, my brain is fuzzy, and I'm really tired. Then I know, oh, what I'm going to look at the clock and see, I haven't eaten for a long time. That means that it's time for me to eat something now. And so we can use things like that, our energy levels, our sleep quality and quantity, our performance, and if it's available to us, things like hunger and fullness, and use those biofeedback methods for as long as possible so that we don't develop a reliance on macro tracking like from the very beginning, because that can lead us then to lose touch with those signals and then not know how to eat without them, without macro tracking. And then is the plan to macro track until we're 85? Like, that's not realistic. So to keep in touch with those things. And we can also integrate external things, like I mentioned, looking at time, things like plate planning. It's even possible to integrate some macro tracking and those internal signals, saying, this is my macro tracked meal, but 30 minutes later, I'm still really, really, really hungry. Now, some amount of hunger is likely in an energy deficit. So the next thing is to recognize that, okay, some level of hunger is going to be present, and then working on developing a lower reactivity to hunger. So to say, and this is this is a delicate area, but to say, I'm not going to allow myself to get to a 2 on the hunger scale, because then it's going to be really hard for me to make intentional decisions. But I might notice that I'm hungry 4 hours or so after my last meal. That is a normal period of time to start feeling hungry because your stomach is already empty. You've absorbed a lot of the nutrients. Your blood sugar is getting lower. So that's what I mean when I say, we're going to expect there is going to be some level of hunger, but we're not going to allow that to get to the place where it is negatively affecting our quality of life. And likewise with fullness, if we're used to eating to the point of feeling very full, we might decide that, okay, instead of feeling very full, I use like a what I call an RPE eating scale. It's like RPE, but for eating, for lifters. And so we might say instead of getting to a 7, because that's really full, I'm going to get myself to a 5. That's a comfortably satisfied. So still relying on those internal signals. In terms of tracking, tracking body weight can be problematic for some people and not problematic for others. It again really depends on that person's history, the context in which they're tracking. For some people, it can just be helpful information, like, okay, I've got my weekly average, which we can get from 2 weights per week, 3 if we want to get an outlier. We don't need to be tracking every day. And we want to minimize the potential excess body checking that can come from being in a weight loss phase. Like some people are weighing themselves, they're measuring their inches, they're looking in the mirror, they're squeezing their skin, trying to squeeze body fat. Those types of body checking behaviors can worsen our body image. So we want to just use that type of tracking and the lowest dose possible, the lowest effective dose. And the same thing goes for things like calorie tracking or macro tracking. And maybe we don't have to use those at all. We can go just based on portion sizes. So when we look at the minimum effective dose for tracking food intake, looks like 5 days a week is what's effective for weight loss. But you can get down to 3 days a week if you're in the weight loss maintenance phase. And when we look at long-term weight loss maintainers, they do report that they have some idea of what they're eating. They have like an idea of their energy balance, of their calorie intake. So those would be the main factors. Is that we want to be set up some psychological protection buffers in terms of protecting our body image and having the skills to practice things like self-compassion and responding effectively to negative body image thoughts. We want to ensure that our appearance checking, we want to make sure that our monitoring system is set up in a way that's not going to lead us to be preoccupied by our shape or our appearance. And we want to ensure that we're still maintaining connection with those internal signals. And so it's much easier then, once the weight loss phase is over, to transition off of the tracking aspect and having an idea of what we need to eat to feel satisfied and energized. And that all of this is built on behaviors that are sustainable long term, because that's the idea, right? Like we want to be able to keep this up for a long time. And we're not going to be able to do that if our weight loss plan is 5 days a week in the gym and not eating carbs and tracking everything. Once we stop doing those behaviors, we're going to revert back to a weight we were. And if we haven't protected ourselves with, the psychological flexibility and body image flexibility, that weight regain is going to be very distressing to us and then can initiate a cycle of repeated weight loss and regain.
And to add to what you said, something that you've been implying, but I think is valuable to express in more detail, is that weight loss is or intentional weight loss is a time bound intervention. I believe that some people engage with intentional weight loss thinking that that way of eating specifically, so being in a calorie deficit, reducing your caloric intake, is going to be their new way of eating forever. For example, when I was really young and I first attempted intentional weight loss, and it ended really badly in an eating disorder, yay, it was because I had no idea really about all these risks and benefits, but also just about the basics of what a calorie deficit was. So when I started intentional weight loss, I thought that the way I was eating to lose weight had to be the way I was going to maintain that weight. And while people who are older than I was and more and wiser who are listening to this podcast probably don't think that way, it can feel like when you embark on a intentional weight loss journey, especially if you have a lot of excess body fat that you would like to lose, that is your life for forever. And it can be it can wear you down psychologically. So I thought it was really important when you mentioned that this is essentially a phase, and once it's over, you are going to transition back to maintenance and away from some tracking behaviors potentially. But also, you can take breaks throughout this phase. For example, I routinely have my clients take deficit breaks. Even if we're
Mhm.
not done with the deficit per se, but if something comes up in their life where they want to prioritize their life outside of fitness and to have the energy to deal with whatever has come up. They want to be in a state of energy maintenance or a neutral
Mhm.
energy balance as opposed to a calorie deficit. That's the perfect opportunity to take a break from the deficit. And the way I see it, it can only bring positives, because if you are embarking on an intentional weight loss journey, my expectation is that you would like to maintain the weight loss that you achieve. So,
Mhm.
to me, taking deficit breaks can really potentiate your ability to do that, because you are practicing maintaining the weight that you have lost so far, is instead of practicing being in a deficit, because the two are different and the behaviors
Yes.
required are different. Especially the level of flexibility involved is different. And I find that it can be um, quite a shock to the system to go from the level of discipline and flexibility involved in intentional weight loss to the level of flexibility involved in weight loss maintenance, which is obviously far more, because a calorie deficit is the smallest calorie budget that anyone will ever have.
Yes, absolutely.
Sorry, I went on a ramble, but
No, that's great.
those are just the thoughts that came up as you were talking. Now, we have talked about when the fact that, we talked about a scenario in which intentional weight loss is relatively safe, but
Mhm.
also I want to touch on what to do if, after listening to this conversation, Gabrielle, I decide actually I am not in the right place for intentional weight loss. I have a lot of the mental psychological red flags that you brought up. I really would like to ask you to explain what one could do instead, because I think that otherwise the listeners might think, okay, I can't do intentional weight loss, then I can do nothing, I am stuck. And that feels really
Mhm.
hopeless.
Absolutely. I always am an advocate for working with a mental health professional and or a coach, depending on the depth of the psychological distress, and working with the both of them together. That's what I've seen to be the most effective in my clients. Um, that being said, in terms of the more practical, like what can I do in terms of health and fitness? The great thing is you can still engage in the same behaviors. The difference between a weight neutral and a weight focused approach is literally just the tracking of weight and or food intake when we're talking about a weight focused approach. A weight neutral approach still includes physical activity, uh, intentional eating behaviors, and intentional nutrition and food choices. It still includes other aspects of wellness that are sometimes lost in the weight focused interventions when we're talking about finding ways to promote and support your social wellness, your philosophical wellness, your occupational wellness. So it's really just a more comprehensive approach that is taking the focus away from weight, which is not a behavior, it's just an outcome, and calories, which are kind of a behavior, but are not going to, your awareness of calories isn't necessarily going to dictate the magnitude of your weight loss, because we still don't know things like what's my actual energy expenditure and how accurate are these calories. You can still experience weight loss without counting calories, because we do see that that is the case for some weight neutral interventions, that at a 1 year follow up, the weight neutral and the weight focused interventions have both lost relatively the same amount of weight, which is a very small amount. I mean, it might be a couple of kilograms, but that's just to say you don't need to be tracking the calories in order to burn them. So what you can do instead, and even in place of engaging in behaviors to lose weight, it's much more important to engage in behaviors that are going to be supportive and reparative to your body image, to your relationship with food. So it's like an overuse injury. If you have a messed up shoulder, going in and doing bench press every day or 3 times a week, even, your shoulder is not going to recover. You need to have a different approach to the training of your shoulder that's going to focus on the reparation of those tissues. You need to go to a physical therapist. You need to do rehab exercises. And this is the same approach that when you see, I'm not ready for intentional weight loss. I have all these risk factors. That's, I'm not ready to bench press. My shoulder hurts when I move it. Bench pressing is a bad idea. What can I do instead? There's still a lot of things that you can do instead. You don't just like stop moving your shoulder completely, but instead you have to find other ways that help to actually repair your shoulder, other skills, other techniques. And so, in lieu of trying to reduce your body weight, you might focus instead on building a more positive body image. And you can do that through targeted body image activities, through things like journaling, through meditations, through self compassion practice. You might focus on getting back in touch with your hunger and fullness cues, not in terms of trying to reduce your body weight, but just to notice what are the foods that actually leave you feeling really satisfied for several hours? What are the food combinations that you really like? You might try habituating foods that you have felt like you can't have in the house because, if you eat them, then you're going to eat too many of them. That's another really valuable skill. So there are other ways that we can focus on improving our health and well-being. And I haven't even touched on the other aspects of wellness, but there's a lot to be said also for practicing setting boundaries and effective communication, or picking up a new hobby, learning a new skill. These are all things that can help you feel more confident and more self-efficacious, and to build trust in yourself, because that's another thing that's really lacking in folks who have been chronic dieters or who have internalized weight stigma, is that they don't trust their bodies and they feel like they're constantly at war with them and that they constantly need to control them. And the reality is that they just haven't had time to build the emotional self regulation skills and the psychological flexibility and the positive body image that can help them feel more calm and respond to these situations in different ways, and in ways that help them feel more empowered and more fulfilled.
The way I look at somebody who has all these red flags and for whom intentional weight loss might not be appropriate differs depending on the person. If somebody has these red flags and they would not benefit from intentional weight loss in even a from a physical standpoint, it wouldn't reduce their blood pressure, it wouldn't make them better able to walk without knee pain because of their weight and so on. In that case, my view is that these red flags signify that weight loss isn't the right solution to your problem. And so, what you may find is that when you pursue the correct solution and you actually solve the problem, you also no longer want intentional weight loss because you solve the problem. When the problem goes away, you don't need to look for another solution. When
Mhm.
on the other hand, somebody would benefit physically from intentional weight loss, I don't look at these red flags as forever precluding you from pursuing intentional weight loss. I simply see it as a shift in the order of your action steps, to where the first action step is no longer intentional weight loss, is it is solving the problems that are the root cause of your red flags. When you no longer have those red flags and you still think that intentional weight loss may benefit at least your physical health, that's when it will be appropriate to take it as an action step. So this is the differentiation that I make in my head.
Yes, exactly. And one thing that I think is important to point out is that, we've talked a lot about weight loss for health, um, and weight loss, like in the context of internalized weight stigma and whatnot. A lot of clients come to us because they want to pursue cosmetic weight loss. And like you pointed out, when a person has a normal level of body fat, that doesn't necessarily mean that they're going to be at their leanest. Most of us are not going to have abs when we're at a normal and still health supportive level of body fat. An intentional weight loss is not going to provide them with any health benefits. Like, there's nothing to improve. This person already they're metabolically healthy. They don't have any elevated risk factors. In that case, the intentional weight loss is really almost just a risky endeavor. There's not a lot of a cost benefit ratio there, because again, okay, the person likes their body image more, their appearance more. That doesn't mean that we've improved their body image. And maybe the person feels more confident, but is it because they really feel more confident in their abilities, which is what confidence is actually about? Or is it because they assume that now that they look a certain way, they're going to be more successful and that people are going to treat them better? Which is true. But unfortunately, that also is a product of weight stigma, and that further perpetuates the internalized weight stigma. And so, when I think about like the worst the worst risk to benefit ratio, it really would be the individuals who have nothing physically to gain in terms of health from the intentional weight loss, and are potentially overvaluing their appearance even more, and are further perpetuating these stigmatizing ideas that will not serve them over time, because bodies are going to change. And whereas they could have focused first on, like you mentioned, we change the order of events and say body image, psychological flexibility, self-regulation. If you're still like, I just want to lose weight for fun, because there are people that do that are like, they do a physique competition and they're like, that was cool, and I sculpted my body, and like now I'm just going to go back to normal life. Those people already have those things in place. They mitigated the risk as much as possible. They knew what the after effects were going to be, and they were ready for damage control afterwards. And so they were able then to reintegrate back into their normal lives. And really, then, it was a risky endeavor in the same way that like rock climbing and mountain climbing and skydiving are a risky endeavor. That we're aware of the risks and we can effectively protect ourselves, and we can deal with the potential consequences as well. Like in that respect, I'm like, hey, that's awesome. It's just the issue is that there are not a lot of people that are in that position because they don't have all of the information. And instead, they're in the former camp where they're like, I just need to lose these 15 pounds. I just want to look better. I feel better when I look this way. I feel better when I'm in a smaller body. And those things are true. And also, that can be a really problematic way of existing because it's so contingent on looking a certain way. And it's not something that comes from our own strong sense of self. Like, you can like the way you look, there's not a problem with that. And on the other hand, we have to keep in mind like where that's coming from, and how much the way that we like the way we look dictates our psychological health and our quality of life.
I'm really glad you brought up cosmetic weight loss and that you made that important clarification that really speaks to your ethos that you explained earlier, where you just want to give people information. Because you said if you don't need intentional weight loss from a physical standpoint, then there's no risk to benefit analysis. It's almost all risks. But then you also
Yeah.
pointed out that that doesn't mean that you shouldn't do it. You
Mm-hmm.
still have the choice to pursue intentional weight loss, even if you don't need it. What's important is that you have the structure in place to protect yourself from the risks. And I especially resonates with me because I love bodybuilding. I don't compete
Mm-hmm.
right now. I don't know when or if I will, but I really like the pursuit of building muscle. And every now and again, once I've built quite a bit of muscle and also quite a bit of extra body fat, I'm like, well, maybe I'll take
Mm-hmm.
care of the body fat, even if technically I'm not overweight and I don't have obesity, but I like to experience both aspects of the process. However, um, right now, compared to when I had an eating disorder, I don't feel any more or less comfortable or worthy in my body, depending on what it looks like. to me is
Yes.
I conceptualize it in the way I conceptualize writing, because I'm a creative writer when I'm not coaching people.
Mm,
I love writing stories and I want my stories to be really good, but that doesn't mean that I
mhm.
hinge my worth upon them. Like if my story is
Yes.
less good than I would want it, it's gonna piss me off, yeah. But it's not. I'm not gonna sleep at night or engage in self-harming behaviors because I couldn't write it as well as I
Yes.
wanted to. So it's the same. I am
Yes.
creating a story or sculpting my physique, but it's separate from me. It's not who I am, and it's
Yes.
not all there is about me. I just happen to wear the flesh as opposed to have it on my laptop in the form of a Word document.
Yes, exactly. That's exactly you said, like, it's separate from me. So when we can separate our sense of self-worth from our appearance, then modifying our appearance doesn't have a strong effect on our sense of self-worth. And like I've done the same thing where I'm like, "Ooh, I a couple years ago I did a bulking experiment because I had a bunch of peanut butter pie from Costco." And I was like, "Oh, this is going to be fun." And I took before and after pictures and I was like, "Oh, that's cool." And like there have been times in my life where I've been more sedentary. I've been really focused on a work project. And I'm like, right now, it feels so good to just be writing. And no, I'm not going to go to the gym today. I'm going to go to the gym tomorrow instead. Maybe I go to the gym 4 times a week instead of 5 or 6. And my physique changes. And then when I go back to going to the gym way more often and I'm more active, my physique changes again. And especially as I've gotten older, I'm like nearing 40, my like my body acceptance and my flexibility has improved so much as well because I'm like, I understand that part of my concern is coming from my age and what society wants me to believe about my appearance. And the source now of my motivation is more focused on maintaining my insulin sensitivity and maintaining my muscle mass as I am into the years where I'm starting to lose those things. And so it's cool to see that my body is so adaptive and it's cool to see that I have muscles. And at the same time, when I don't see my muscles as much and when I have more body fat and when I'm not as active, again, like you said, I don't feel like I'm worth less. I don't feel like I'm not being a good person. I'm just aware I've been making different decisions lately and I know why. And I'm going to make different decisions from this in the future. And it's not coming from a place of anxiety or fear or body dissatisfaction. It is really coming from a place of, oh, I want to take care of this meat vessel that I'm in while I exist on this planet because it's the only one that I get. And so, the motivations feel different and there's not this level of pressure and stress. Like I don't want to count macros. I don't feel obligated to count macros and so I don't. And I just feel comfortable, eating the things that I know are satisfying in reasonable amounts. And sometimes I eat chocolate and being in a place where there's the stakes are not high, I don't feel pressure to restrict and I don't get stuck in these cycles of like restriction and then overeating. And it's just like, it's nice to be able to exist calmly in one's body and like be able to watch it change and pursue those projects, but not have the way that you look dictate how you feel about yourself for the whole day.
Thank you for sharing that, Gabrielle. That was beautiful. And I think we did an excellent job today of giving people the autonomy to make the choice that's best for them at this moment in time. Is there anything before we wrap up that you'd like to touch on again or bring up that if we haven't covered it in your view?
I think we did, like you said, we did a fantastic job. We've covered so much, and I really appreciate the opportunity to talk about this. And if I can, I would like to let people know that I have a book coming out next year. The working title is Beyond the Scale. It's either going to be Beyond the Scale subtitle, like a comprehensive approach to health and wellness coaching, or coaching for wellness in a weight obsessed world. And the book is in 3 parts. It first covers the history of and the origins of diet culture and wellness culture, and then talks about weight stigma and looking at the social justice movements associated with weight stigma and weight neutral approaches to health and wellness. Then, like we talked about today, it talks about the risks and potential benefits of intentional weight loss and how we can pursue that in the most effective way possible. And then goes into my take on kind of my created approach to coaching based on one's capacity and helping them to build skills, not just around eating, but also around self-regulation and promoting a positive body image. And so I'm super excited about it. I'm about halfway done now, and it's going to be geared toward health professionals. But I do think anyone who has a body and is thinking about changing it would benefit from that. So I do send out little sneak peeks on my newsletter as well. So if anyone is curious, then absolutely get in touch with me on Instagram.
That's really cool, Gabrielle. I wish you the best with the writing and editing and the publishing process. And I was going to ask you, as the final question, where people can find you and connect with you, because then I'm going to add all of the links in the show notes so everybody can keep up with your writing process and the rest of your work.
Awesome. Yeah. So you can find me on Instagram at trust_and_nourish, and at my website, trustandnourish.com/start. Because that is where you get started. Whether you're a coach or you're on your own wellness journey, I do have resources for both communities. And yeah, I'm super excited about the book. This is the second one that I've written. The first one was about gut health, and this one is much more enjoyable.
I'm so glad that you are enjoying the experience. On that note, Gabrielle, thank you again for coming onto the podcast once more. Dear listeners, thank you for tuning in and gifting me and Gabrielle with some of your precious time. And I shall talk to you in the next episode. Lastly, if you want to support the podcast and help me reach more people, please leave a 5-star rating or review on any podcast platform that you're using. Thank you very much for listening, and I'll speak to you soon.